Ondiro, so there was quite a public exchange of words between the leaders of Rwanda and South Africa, but what prompted the, quite vitriolic response out of President Kagame?
Hi, Jumana. So all this began when South Africa's defense minister said that President Ramaphosa had warned that any other attack on South African troops would be tantamount to a declaration of war after South Africa lost 13 soldiers in the eastern part of DRC. And President Paul Kagame did not take this lightly. He took it as the threat that it was. And during the extraordinary Heads of State Summit, he took the opportunity to address it. And he was even challenging South Africa to clear the mess in eastern DRC if they have the power and might, instead of fighting those who are. On the other hand, you have the South African Foreign Affairs Minister who's trying to tone down and clean up the situation a little, saying both presidents have not spoken since that public exchange, but President Cyril Ramaphosa is open and keen to have dialogue with President Paul Kagame of Rwanda. He also says that South Africa is not a warmongering country. What they operate on is a broad mandate that for economic development to happen in Africa, all guns must be silenced. And he calls for some calm and refrain because inflammatory remarks can easily affect diplomatic processes.
Yeah, well, that's the political discussion that's going on in the background. But talk to us about the potential health risks that could arise right now from the current fighting that's taking place in eastern DRC and in Goma.
Jumana, so just to put into context for you, 3 million people live in Goma, 1 million people displaced, and this is a health risk in itself. The Africa Center for Disease Control says that the war is exacerbating the risk of disease outbreaks, diseases like mpox, measles, cholera, and the Director General for Africa said, and I quote, "Guns cannot kill all of us, but outbreaks can." WFP has halted the distribution of basic nutrition because the fighting has almost jeopardized the health and safety of their staff, and access to food is becoming really difficult. Ports have been blocked, roads have been blocked, the airport has been blocked, and you also have WFP saying that the next 24 hours are going to be critical because supply of water and food is really running low. If you look at their hospitals, they're overwhelmed by the numbers of people who are injured, and this just goes to put further strain on an already strained healthcare system, and if an outbreak is to happen, the fighting chances then become lower.